Welcome. I am Christine Ann Townsend, Bachelor Prepared Nurse and International Lactation Consultant. We are here today to talk about teaching with technology, enhancing 21st century interprofessional education competency. Teaching in the 21st century for healthcare interdisciplinary education and professional needs to meet the standards and calling of the governing organizations, populations, and global competencies. Technology must be fully integrated seamlessly into all professional healthcare education institutions and systems. The purpose of this research article, PowerPoint presentation, and transcript are to educate how, why, and purpose of implementing web, Animoto, YouTube videos, and simulation technologies into the healthcare education. The presentation is for faculty and administration in organizations that teach college healthcare education from associates to bachelor's to doctorate programs. The presentation is to educate faculty and administration that teaching with technology meets the call for diversity, innovation, improving critical nursing thinking, interdisciplinary education, and the competencies of the National League of Nurses, quality and safety education for nurses in the Institute of Medicine. The new 21st century teaching and learning environments are one of using all ways of knowing and meeting all types of learning styles, diversities, and cultures. Teaching today is done by providing a menu of options to allow the students' knowledge to develop from their foundation in a multidimensional way. Linear learning is gone. The 21st century teaching in the healthcare system is technology. Course content, electronic healthcare records, evidence-based practice libraries all require information literacy competencies and community engagement. Everything and anything on the web is a potential source for education, technology, teaching tools for the 21st century educators, students, and all knowledge explorers. Modern teaching and learning is a continuum with constant interaction and discussion with all groups of people from many diverse backgrounds to give a rich and deep, meaningful learning experience for all. Technology binds the educator and the healthcare system to be patient and learner-centered, interdisciplinary collaboration, information literacy, evidence-based practice, safe, promote quality improvement, meets organizational guidelines and the competencies of the 21st century. Pure knowledge to life. Teaching in the 21st century with technology is using all the senses, critical reasoning, permanently entrenching knowledge into every learner from every comfort zone, learning style, multiple ways of knowing, and generation from Patrick Benner's theory of novice to expert, wisdom, and synthesizing Bloom's taxonomy. The learner and the educator are collaborating to achieve being competent simultaneously. Technology into interprofessional education and interprofessional teams are the ways to improve communication, collaboration, combine resources, all in the efforts of restoring and maintaining the health of individuals, families, the community, and society. Innovative technology strategies of using YouTube videos, Animoto, and simulation labs are important teaching strategies to implement in the healthcare learning environment for a novice to wise healthcare professional. Animoto is an easy way to make learning videos that excite, are interactive, evoke discussion, and everyone can use. Innovative technologies like Animoto are necessary to enhance educational process for the self-directed learner population of interdisciplinary education and the increasing complex healthcare delivery system. The healthcare system, technology, learning, and evidence-based knowledge and research is in continual flux. It is important to instill on the first day of class in a healthcare professional education to students and faculty, learning will be part of every moment of your life. Why not start with a creative, beautiful musical Animoto to bond the teachers and students? An Animoto can be a short 30-second introduction to the discussion of the day or a group project for a complex case study. Animoto assists students to make a connection, meaning, and creates an in-depth autonomous learning. Animoto has infinite possibilities in the 21st century technological IPE. YouTube is an innovative method of information and communication technology that supports the 21st century IPE teaching to strengthen the cognitive, psychomotor, and affective clinical skills. YouTube videos can be used to enhance IPE from basic skills to clinical skills to communication exercises. YouTube videos can be combined with evidence-based practice research, tests, group projects, patient education, face-to-face and online interactions. YouTube can create a plethora of high-level critical thinking. YouTube videos can involve all healthcare professionals to expand on working from the most innovative, fun, and research-based evidence across generations, diversities, borders, and oceans. The benefits of teaching with YouTube videos or any sound evidence-based videos is that the students report an increased cognitive and procedural knowledge, increased student satisfaction with learning, decreases anxiety, superior in performance outcomes, and increases students' confidence compared with traditional teaching methods. The flexibility of self-paced and repetition of videos are additional factors to YouTube. Videos that have a human, social, and emotional components produce the greatest enhancements of critical knowledge, skills, attitude, competencies. Encouraging healthcare students to research evidence-based, reliable, valid, and quality credible education videos increases information literacy, which is extremely important competency for a professional healthcare provider to accomplish safe, efficient, effective, and caring patient outcomes. As an example of YouTube videos we can use in classes to have students watch a video at home on a 2-minute basic life support with a checklist of steps for the BLS for the first 2 minutes to assess the video for sequencing, timing, and did the steps occur at the right time, any errors. They can come to class, then do a simulation of the BLS and have a feedback and debriefing. Simulation is a dream come true. Simulation supports the Institution of Medicine's triple aim. Simulation improves healthcare. High-fidelity patient simulation can be used to develop critical thinking and respect everyone's learning styles, and including all the healthcare professional team from the lab technician to the CEO. Experience a real-life, high-fidelity patient simulation is surreal. The concierges and lab managers teach about how to treat the mannequins with respect as they are real. Mannequins can cry, have emotions, we talk for them, diaphoresis, respond neurologically, pupils dilate and contract. Can have signs of stroke, facial drooping, cardiac arrhythmias. Pulses can be palpated and changed, and of course lung sounds can be manipulated. The simulation atmosphere is to be a safe place to be yourself. The core objective of the day of the observation of the high-fidelity patient simulation was to be interprofessional education, IPE. The patient stayed the same as an elder man with pneumonia and wife at the bedside. Each circumstance was slightly altered, but the critical reasoning was amazingly different for each. One was the patient was getting anxious. I think I'm having a heart attack. My chest hurts. Why is my wife so quiet? Over and over and louder and increasing his anxiety level. The students did a great job teaching the patient how to deep breathe, imaging, but this did not help the patient. When the students started to engage the wife in the care, the patient heard his wife talking and being included, he relaxed. The chest pain disappeared and he was able to do his breathing treatment. The patient thanked the IPE team for including his wife. The patient's wife hugged him and he fell asleep. Simulation ended. It is vital to think outside the box of using simulation, case studies, and hand-on experience in the Learning Center. A briefing gives them the rules, expectations, goals, and outcomes that they need to achieve. The clinical day or simulation is a hand, mind, soul, and heart encounter. It's very important to have a debriefing after any learning activity to allow for open discussion of what each person learned, review what was gained or not, misconceptions addressed, and review goals where they met. Feedback for more improvement is paramount. Simulation labs can be used to meet a plethora of learning objectives and outcomes and be inclusive of all types of learners. Mannequins are treated as people. respect their autonomy by addressing them by names, meeting health and psychological needs. We hug our mannequins and they have names. Dr. Jean Watson loves nursing, IPE, and simulation. Technology enhances learning by making it fun, interactive, and meaningful. Innovative technology allows finding evidence-based practice research answers quickly and create fascinating ways to visualize, listen, touch, and explore new knowledge and paradigms to make it a wow moment that can last a lifetime and meet the healthcare professionals' confident outcomes safely. As Nelson Mandela states, education is the most powerful weapon which you can use to change the world. Thank you.